Metastatic castration-resistant prostate cancer is the most advanced form of prostate cancer. As we know, prostate cancer is the second most common cancer among men worldwide, with 1.4 million men diagnosed each year. But over time, many men have the disease spread outside the prostate. And at that time, we start treatments with androgen deprivation therapy. Many men will experience what we call castration resistance, or where the tumor stops responding to the androgen deprivation therapy. At this point in time, the disease may be more difficult to manage and more likely to cause symptoms. And so these may manifest with fatigue or pain, and this may affect your ability to live life and do your normal daily activities. Most men with mCRPC have their life expectancy now measured in years, and so it's really important to offer new treatment approaches that can extend life and as well preserve quality of life. Bone metastases are one of the predominant forms of the disease when patients develop metastatic castrate-resistant prostate cancer. We know from many historical studies that the predominant site that prostate cancer likes to spread is to the bone. And not only is this very common, it also contributes to the symptom burden of disease. When disease becomes more advanced, these metastases can become symptomatic and both cause pain as well as pretty major medical events like fractures. Skeletal-related events can cause major disability and affect quality of life, affecting not just physical function, but emotional and functional well-being. As a result, when we look to treat patients with advanced prostate cancer, avoiding skeletal-related events is a really important endpoint. And we know that they may occur every few months, a few times a year. And as the disease progresses, early intervention and early effective treatments are really critical in preserving both quality of life as well as duration of life. For patients with mCRPC or metastatic castrate-resistant prostate cancer, there are many unmet medical needs, and we're very lucky today compared to the way we were 10 or 15 years ago in terms of the number of proven life-prolonging therapies we now have available. But for patients with mCRPC, this is really a terminal condition, and palliative care is what we are offering. In the meantime, we try to both extend life and help people live longer and to preserve quality of life. And so we want to prevent the development of symptoms or delay the development of symptoms. And this may be bone-related pains. It could be a weakness or other functional impairments that get in the way of your day-to-day activities. And so while we have a variety of treatment options available to us, inevitably resistance develops to most of these. And so new treatment approaches and new ways to sequence our existing treatment approaches remain a critical avenue of research for all of us who treat patients with mCRPC. In my experience, there's a wide variety of experiences for patients with mCRPC or metastatic castrate-resistant prostate cancer. This in part reflects the fact that patients arrive at this space from different trajectories. Some may present with high-volume metastatic disease up front. Other patients arrive through a pathway from localized disease through mCRPC and the eventual development of metastases. And these patients have experienced different burdens of therapy before they get to mCRPC. Certainly one of the things that we know is that the more treatment lines we can help our patients receive, the better they're likely to do. And one of the big barriers and sort of hurdles I think all of us are working to overcome is the fact that in population-based research, at least, we're finding that many patients receive maybe only 1 or 2 lines of treatment, even though we know we have 4 or 5 or more lines of FDA-approved therapy. And so as we look to the future, I think finding new and novel ways to combine treatments and sequence treatments is critical to helping preserve quality of life for patients and maximize their survival.